today we're going to be covering a very controversial subject, which is the new safe consumption rooms in Glasgow.
It needs to be more accessible. Having one in the city centre ain't any good to anyone.
Should we not have hospitals because they're too far away from people's houses, or what's the alternative then? Because it has to be so far away from the north end, it means we just don't have them. What about the people it's helping close to where it is?
The general consensus for 97% of people that I asked, they said categorically they would not go down to a safe consumption room and use.
The majority of what we're seeing now is cocaine based. Care and street Valium are the two real dangers in North Lanarkshire at this point in time.
I would have them everywhere, right? But let's be honest, we're not going to have the funding to have them everywhere, so you need to concentrate them on where the most harm is.
I'm not totally against a safe consumption room. I'm against there's the legislation around it, the 300 people used it in the first week. I don't believe that.
So welcome to another episode of Social Sessions, and today we're going to be covering a very controversial subject, which is the new safe consumption rooms in Glasgow, and we've got three people here today to talk about it. So I'll just quickly introduce everybody. John, do you want to introduce yourself?
I'm John McGhee. I'm a PhD student at the University of Glasgow looking at drug deaths in Scotland. I've also got my own non-profit organisation looking to help people coming out of prison in Scotland as well.
Natalie?
I'm Natalie Logan. I'm the Chief Executive of SISCO. We're a prison charity. We support people in prison and people in the community.
Ian?
My name's Ian. I'm an arrest referral worker within Addiction Services.
So obviously, we know, right, this is a very kind of controversial subject. A lot of people get different opinions, right, and we're obviously going to cover quite a lot today, right? So the first kind of part that I was kind of going to just look at, right, was obviously just the kind of introduction to it and just the understanding of what a safe consumption room is. So my take on it is basically the death rates are through the roof. They're wanting somewhere safe for somebody like intravenous drug users to kind of go and be safe. Harm reduction obviously is a big part in some of the stuff. Some people say, isn't it? They want to, we'll just kind of open the room, they want to kind of take it up.
That's kind of my understanding of it as well. It was a reaction. I can't remember the guy's name, but it was a reaction to the rise in drug deaths. And was the guy was it Peter somebody? Was he not an ex?
Peter Criken.
But that guy, I used to see him on Twitter. I don't know him. I've had no interactions with him. But I think he was an ex-addict, was my understanding, and he started campaigning for it. And it was just a direct response to the rise in drug deaths in Scotland.
Obviously, Natalie, you kind of work with kind of quite chaotic people that are still in the streets using that. And what's the word on the streets with it?
It's not great, Sean, to be honest with you. So I'll come in not as a professional, I'll come in as somebody that is in recovery, somebody that supports people that are still actively using. The general consensus for 97% of people that I asked, they said categorically they would not go down to a safe consumption room and use. For where I come from, so for the north end of the city, so if I'm out grafting all day, right, to get a score to go and use, then I need to get another £5.60 for a bus pass to go into the city centre. That's a lot of head work, right?
Aye.
The bottom line is, if I'm going to go for a charge and postal, I'm either using in the house or I'm using in a close. I'm not going to go down away into Glasgow city centre, and everybody that I've spoke to said the same thing. So we're working with chaotic users. So the bottom line is, my job's not to keep people sick. It's to get people better. It's to offer a better solution.
So I would agree with that. Is it them that would kind of...
So what I would ask a direct response to that, Natalie, is, so should we not have hospitals because they're too far away from people's houses, or what's the alternative then? Because it has to be so far away from the north end, it means we just don't have them. What about the people it's helping close to where it is? We can't have everything or I wish we could have everything close, but see if they were to open in the North End, would you then be saying, oh, that's a little bit that can help you, will you go there? Or would your position still be, or do you think the people who you've spoke to, sorry, because it's not really your position you're talking about right now, the people that you've spoke to, do you think they would go, aye, that's right on my doorstep, do you know what, I would actually go and use that? Do you think they would also say, when you take away the £5 odd bus fares and all that, and it being right there for them, do you think they would still be like that? Nah, I'm still not wanting to use that. Is that the feeling you're getting?
It's not the feeling, it's the general consensus that people, what's safe about it? What's safe about a safe consumption room if the legislation and the law says that we'll still charge you with possession? So what makes that safe for an active? If I'm actively using drugs and there's a safe consumption room, which a lot of people will say that's fantastic and good if that's your opinion. If that's your opinion, that's great. But I'm not going to risk going down with a bit of smack or a bit of coke into a consumption room knowing that I've got a warrant out for me. And if you're anti-authority, like you're naturally going to be against any type of system. So for me, like, to create safe spaces, there's safe spaces in rehab. So why are we not saying to people, there's 3 tiers in rehab, so see for your first tier, we'll create a safe space for you and we'll let you use for the first 6 weeks and then we'll titrate that down. That for me would be a safe environment because there's psychosocial supports in place. But just opening one space in Glasgow and saying every drug user for Scotland going there, logistically that doesn't logistically work for me as a person or for the people that I support.
So in general, you do support safe consumption rooms, but they have to be, it would be better if the funding went towards a tiered support system rather than it just being we open the room and people can go there. There has to be other sort of wraparound services to go with that. Is that what you're saying?
So there's always got to be harm reduction, right? Because it's not harm reduction versus recovery. That argument has to be, we need to stop that argument. We need to have both. There's a place for both. But what we're really, really good at doing is saying, there's a room for that, and there's another room for that, and there's a room for that. And we divide everything instead of saying, these are all the same issues, so let's treat them as the same issue and let's create a tier system where we can address them as a whole. Because we say, oh, we're trauma-informed, it's a whole person approach. There's nothing whole about one safe consumption room if that's just one entity. And then maybe we'll get you into rehab, but maybe we'll not. Do you know what I mean? So I think that there's a place for it, but it needs to be connected with everything all together. Like with your service. And
well, that's one of the things that I've heard in the last couple of weeks is that services aren't allowed in the consumption rooms. You're not allowed to have services in the consumption rooms talking to people when they come in. What's the point?
So
getting these people in the one place, you should have the services there to say, this is available to you, that's available to you, we can do this, we can do that, so that people are hearing this every time they visit the consumption room, and eventually that penny's going to drop and they're going to say, aye, right, that's what I want.
So that would make more sense to me, right, if they allowed services to go down, right? And obviously I think the thing is basically saying they don't want to stigmatise people and they're trying to like allow people to use safely and whatever, but the whole fact to me would be, this is my understanding, I could be wrong, but is there no letting services be at the safe consumption room?
That's what I've heard.
But my understanding was that services aren't allowed to go and like pitch up at the safe consumption room, but of the 300 or so people who went and used it in the first week, it was something like almost half of them got onward referrals to a service.
Is that right?
So they're allowed to refer into services.
I'll just, as a disclaimer, I never researched any of this. As a researcher, I probably should have, but I wanted to come here with kind of blank slate. So what I done last night was I Googled it, and that's just off of some of the top hits, and I was like, do you know what? I actually didn't really want to know any of this. I would rather come in people who work in that area tell me, but that was one of the things that I seen. In the first week, there was like almost 300 people used it. So there is a need for the service for the people in the area, right? And out of them, there was an onward referral because the services aren't in there, but there's like, I think there is like support workers in there that can take referrals and send you on to a more local service for whatever it was. But I never went into any of the links. I just kind of went, oh, that's good, and then come off my phone.
Unfortunately though, at this point in time, there's a 21 day, the MAT standards give you 21 days. So from referral, there's 3 weeks before you get
standards?
seen.
Tell me what I'm not in that area.
The MAT standards are standards that have been brought out to enhance
Medically assisted treatment.
Treatment, is that what it stands
treatment.
for? So what's that, like opiate substitution therapy and that? Is that
Aye,
like-
but they're rolled out across all the services, so it's not just about medically assisted treatment. The MAT standards cover all your addiction services within
Right.
North Lanarkshire.
There's
anyway.
a lot of advocacy and stuff
But
involved. I mean, it's
Their standard is 21 days. Now,
21 days for what, sorry?
from referral
For
to
a
being
referral
seen,
to being seen, right?
right? Now, if I haven't been a user, I can sit the day and say, aye, I want to
I want
access
off
those
it.
services, I want that help, and they put a referral in for me. I get an appointment for 3 weeks later,
You're on it, eh?
I'm on it, I'm
They'll
away.
take you.
you know.
No.
So having that, like what I do as an arrest referral worker, I'll see people that need help there and then. As soon as they get bailed or whatever at the courts, I'm at their house and I'm doing an assessment right there and then, opening them up to the services on that day. You know, that's what I do, because waiting 3 weeks, you've changed your mind.
Aye. And I think that's why people come from a lived experience background so valuable. If you look at like Kev Neary and that Aid and Abet, they kind of do the same thing. They're in the jail going, I'll help you the day you get out, and they're there the day you get out. Whereas people who didn't come from that sort of background, they're kind of like, oh, I'll get to them in 3 weeks, like you're saying, because it's kind they've got, but also they've got a workload, they've got funding to think about, and they're like, I'll work my 9 till 5 doing this, and I'll get through 5 referrals a day if I can, and then they'll clock off. Whereas it's hard for us to clock off.
It is.
You know what I mean? It's hard to like, you know what? I really wish I had that service there when I was getting out. So I can't imagine taking that away from the 5 guys I could see in your spare time. You're like, I've already clocked out, but I could go and be helping. So I get that.
So see, I'll ask you this, right? See, like, if we were all growing up, right? So say I'm Cumbernauld, Muirhouse, Cumbernauld, Postal, right, Springburn. If there was a safe consumption room there, right, and we were taking cocaine and stuff like that, and you were going out or you were going to take an eckie, do you think you'd have went down and went into the safe consumption room, or is it only intravenous? Is that what it is? So it's any other drug use?
I don't know, but
It's
I do
only
know.
intravenous. So just now they don't have the facility to even smoke kit or crack. So it's only for intravenous drug users.
But knowing now that you can still be prosecuted walking into a safe consumption room, I wouldn't go anywhere near the place.
So this is actually I've done a bit of work on it actually with the SRC.
What's the SRC?
Scottish Recovery Consortium. So the prosecution policy on Glasgow drug consumption facility, the Lord Advocate has made a statement on prosecution policy. So this was published on the 10th of January this year. And they had said they cannot change the law, and she does not have the ability to make possession of drugs within the facility legal. Possession of drugs within the facility will remain a criminal offence.
Wow.
Yeah.
The policy states that it would not be in the public interest to prosecute users of that facility in terms of Section 5(2) of the Misuse of Drugs Act for simple possession offences committed within the facility. However, it is still illegal because you'll get done with possession of drugs.
Aye, but what they're saying
So
is
they're
they're
relaxing it.
Aye, but what they're saying is they're not going to prosecute.
No, they're
'cause
not
it's
saying
on the
they're
public
not going to
interest.
prosecute. They're saying
Sorry, repeat that bit again.
it wouldn't be advisable to prosecute, but
It's not in
or
the
it's not in the public
interest
interest to prosecute. But
They're
that
saying
doesn't
it's
So I
mean
know a
they're
wee bit
not
about this because
going
I've got a law degree and I've studied like the difference between the UK Parliament, the Scottish Parliament, and that. We didn't have in Scotland. We didn't have the ability to do anything. UK Parliament legislation's like supreme. Like there's nothing you can do about that, and it needs to bills and that need to get passed on there. That we didn't have any. It's called competency. We didn't have the competency today. So at the Scottish Parliament level, but what we are able to do, we're not able to set the law, but you're able to set your own. The Lord Advocate up here, what's her name again?
Dorothy Bain.
Dorothy Bain is allowed to set the policy for what's within the public interest and what isn't. So if she's saying she's in full control of that area where she's able to go, do you know what? It isn't in the public interest for me to pursue that, and that gets passed on to her procurator fiscal and whoever else. So they're like, as soon as something comes across their desk, they'll just bin it anyway. And I know that doesn't matter to the guy on the street because they didn't know about the inner workings of what happens at the procurator fiscal level and the Lord Advocate level. But if she's saying they're not going to prosecute it in that area, then that gets told to the police. Listen, didn't bring us any referrals for there because we're not prosecuting it.
Can I ask you this then, John, right? Because you'll know better then, right? Say wee Davey bang at it and he's been robbing as does, and they know he's doing it, right? And he's getting away with it, he's doing it well, and they really want him, right? And Davey decides to use the safe consumption room, can they go in and nab him in there with drugs?
Listen, the post can do what they want, and see, even if there was a law against them not being allowed to do it, even if they changed the law, the post will always do what they want. I wouldn't say I hate the post because they're a wide spectrum of people,
no,
but
of course.
as an organisation, I don't like them, right?
Aye.
I've had my run-ins with them ever since I was like fucking 9-10-year-old, and the posts are always got to do what the posts do. And I get the have wee pocket, like Aid and Abet, for instance, that I mentioned earlier. Aid and Abet works alongside the post. Violence reduction unit, they've got their aim wee pockets, good that they're trying to achieve. But as an organisation, they can't even do it properly at that level because they've got their own colleagues coming and stepping all over their shit. So they would do it, but let me finish, right? So they would do it, and my advice would be to somebody, if they've got warrants and that, is not to go to the safe consumption room, because 100%, like Natalie's saying, they'll see them and they will lift them. So there has to be it isn't just enough to say we're going to have a more relaxed look at people having drugs in that area. It needs to be a full on, listen, we don't care if you've got a warrant for shoplifting unless you're wanted for like a murder or something.
Safe. The word safe has to be broader.
But it has to be a lot broader, and it has to be, and the Lord Advocate needs to come and specifically say, if we see you come into the safe consumption room, and even if we pull you and you've got a warrant out for a fucking shoplifting it, but that's where you're gone, then we need to let you go. There needs to be
Does she have the power to do that?
She's a Lord Advocate, aye. You know what I mean? She's in control of what the sort of public good is in prosecution. So the current policy is, if you're hanging to a warrant, you go straight to court next day.
Obviously, we know how sometimes the law works, right? And do you think she's scared then that Davey gets away with that, and then somebody up in Postal gets caught and then tries to use that as a case and tries to use it? No, but that's what she thinks from her point of view. Because from my point of view, so fucking what? If one or two people get away with it, right? But I get it. We're trying to look at it from her point of view. It might be, without getting her on here and asking her what her point of view is, we're never ever got to know, right? But a lot of the time, people who are up for re-election or up for, like, every few years having to justify their job, a bad bit of press like that has got to look bad on them, and that's why your SPS and whatever didn't bring in things like they didn't have any progressive policies on almost anything, because the Sun, the Daily Record, run mate and slaughter them. So maybe that is something that she'd be too worried about to do that. But if you're serious about, look at Scotland, right? Since 2013, worst drug deaths in Europe, right? They had to do something, right? They had to do something. So unless she's getting serious about actually doing something to combat this, and all the other agencies and services are getting serious about actually doing something, then the Post herself should be coming out and going, do you know what? Within fucking 2 square miles of that safe consumption room, we'll not be lifting anybody for any warrants or anything if they're got to that safe consumption room. It isn't just on the Lord Advocate. If we're serious about saving lives and serious about no having harm reduction for fucking everything, do you know what I mean?
But if they're serious about it, like Natalie was saying, it needs to be more accessible. Having one in the city centre ain't any good to anyone, like you were saying, that's been grafting all day to get their hit.
And why not have them in rehabs and stuff as well?
That's where I would anticipate the safest place to. So for me, rehab's a safe place with therapeutic workers. So for me, it makes sense to have, like, I'm not like totally against a safe consumption room. I'm against there's the legislation around it, the 300 people used it in the first week. I don't believe that. I absolutely don't believe that. I know for a fact, because I've worked at government level, they massage the figures to fit the narrative. So I don't believe 300 intravenous drug users went in there, because see somebody that's intravenously used drugs, the shame and guilt attached to getting into an environment like that to use, definitely don't believe it. Maybe the same 300 people were in and out because they're just using
because cocaine was the most used, but actually wasn't even heroin.
There's nobody using
and you
smack.
Need a hit.
There's nobody using smack. There's 6% of heroin in the smack now. That came from public health. So if you're going to give me a bit of coke where I'm going to be fleeing right out my nut, or you're going to give me 6% smack, I'm going to go for what I'm going to be fleeing out my nut. Then I'm going to take Street Valley. And that's my reality.
The Taliban have basically like.
As soon as go back in power, they're killing all the cops.
There's nothing
shut down the production of heroin.
There's nothing coming over. That's the thing. There's none.
And this is the
synthetics
danger
are
as
bloody
well.
dangerous.
I watched a thing, I don't know if you've seen it, it was Louis Theroux, right? And this was about, it was a similar kind of topic. It was talking about safe consumption rooms in like San Francisco or something like that, right? It was, he was doing it, and it was the big services and that, it were about, and it did look quite nice. It looked like a kind of nice environment and stuff like that. But they were talking to a guy who'd overdosed, I don't know, I can't remember the number, how many times he said, but he said he'd overdosed X amount of times, and I had never really heard. It was the first time I'd heard fentanyl, and he was saying, as soon as you overdose in fentanyl, it's there and then. It's like, it's no that kind of way that the other thing. It's like it's a full on like kind of
you're fucked,
right? And you need to hit naloxone. I don't know many times, right? It's like it's mental how many times you need to do it. And obviously we've no really fentanyl is coming, but it's no hut yet, right? It's no hut. So I suppose like you're going into ethics then, aren't you? And is it ethical to kind of to go like that? Then is it? I suppose what I'm trying to answer, I probably says, should we be opening up more safe consumption rooms in every
100%, right? I remember we spoke about this during my podcast. I think we were talking about safe consumption rooms, and I would have them on every street corner, right? But you're talking, what was the cost of this? 7 million across the first 3 years? 7.5 million?
2.3 million a year.
A year, right? So how are you got to do that even in every major town and city? Do you know what I mean? Never mind in the north of Glasgow, because Glasgow's massive. That's Glasgow and Dundee's where the most like drug-related harms are, right? Is my understanding, right? So how are you got to have? You probably need 4 or 5 in Glasgow to get a proper geographical thingy capture everybody. Dundee isn't as big a city, but it's quite widespread. You know what I mean? So you probably need 2 or 3 there because of how spread out it is. Edinburgh's fucking, all the schemes are on a circle round the outside Edinburgh, so even at that, you could have it in the middle, but you'd have the same thing, like everybody having to get a bus in, the police waiting on you getting off the fucking bus to lift you, right? So I would have them everywhere, right? But let's be honest, we're not going to have the funding to have them everywhere, so you need to concentrate them on where the most harm is. Glasgow just had a massive hike in HIV, right?
I suppose massive that's a good
hikes.
thing. I mean that's got to be a good thing that you're kind of maybe maintaining that. No.
Aye, so I was going to get to that, right? So you were saying about nobody taking real heroin anymore, right? 80% or more than 86% or something of the drug deaths last year were all heroin based, usually mixed with another drug, but people are still taking heroin, and it's what's overwhelmingly killing people. So people are still taking it, and I don't know what
I think methadone was bigger, John. I think methadone was a bigger killer.
It might be methadone along with heroin. And
I think it is.
The overdoses were opiates. It doesn't go into or diamorphine. It doesn't go into like it was methadone. It was this. It was that. But
so just opioids kind of thing.
Opiates. So it might be methadone along with. I mean, there is a breakdown. Later on in the report, say methadone in that, but. And it isn't as bad. Street Valium still killing people, but at one point there was like 90% of deaths were Street Valium. Now it's down to like 60 something. I think was the last figures that I went and when I looked at it.
So you're saying like heroin's kind of making a comeback, but
it's not making a comeback. It's just always been there.
Like,
it's not making a comeback. It's just always been there. I think it's gone down. If I'm being honest, it's reducing for like people are jagging coke.
I know that.
A lot now is my understanding it.
No, David, it is. I mean, obviously, would you like you'll see a lot of things coming through yours? Is it a lot of kind of cocaine based that you're seeing as well?
The majority of what we're seeing now is cocaine based. The vast majority of it. Cocaine and street Valium are the 2 real dangers in North Lanarkshire at this point in time.
I think about 50% deaths up face. It was like used to be 8% of deaths were cocaine based. And your drug-related deaths, and now it's up to nearly 50. It's like 48% or something.
One of the problems with it is, so there's people that are cocaine users that are dying from opiate overdoses.
I know.
You know, why are there opiates in cocaine? Why are people taking cocaine that's got opiates in it?
There's no snowball in it. Is that the thing?
No, this is just your street cocaine.
It's just getting found. It's fentanyl not getting found.
Fentanyl and all that through it, and nitazines and everything that are just people aren't aware what they're taking.
The radar reports are quite scary, actually. But I think if it's cocaine and all. Like I don't know. I don't know. I've never jagged cocaine or anything, so I don't know about it. I've never took it. So is it in the way that like is it still like? Because I know that's no as long a hit. So would you need to be keeping going back to this?
Like Natalie was saying, the thingy's maybe been the same people or whatever. I think that's what it is. Because cocaine, you need to take a hit every 2 hours or something.
Right.
You need to take a jag every 2 hours. It's like when you take a line of cocaine, it only lasts you half an hour or an hour. And then after that, you need to take more. And if you want a bigger rush.
So the stats are saying 300 people, that could be 3 people that have been 100 times.
3 people 100 times. It could be, or it could be, or similar, 10 people 30 times, or whatever. And it likely is, and it's likely more the people who are concentrated. What it says on something, it was something like it was all the ones who would be public using, like jagging in stairwells or whatever in the city centre, are now gone down there, is what my understanding it was. But we're not really got to know until 6 months' time when they release official stats or whatever it is.
They were saying it's like 7 years' time before they've got proper data on it.
They'll have proper data.
Yeah,
they'll have, whether they release the proper data
on
in
that
time,
side,
but they'll have that within.
And what is the proper data?
They need to justify their funding.
I mean, on that side, you're saying it's people that would be jagging up closes and things like that are going to these. That's why I'm for these rooms. They need to be more. They need to be better. They need to be, that safe needs to be a broader spectrum. But if we can stop people from sitting in closes, jagging and leaving needles lying about closes, that's an amazing thing. That's going to help society in general.
It's worth it to me in general, just for that.
So the objectives, right? The objectives is obviously like reducing overdose deaths, minimising the spread of infectious disease, and connecting users to addiction services. On paper, it sounds great, right? Now, I'm probably against it, right? If I had to choose, I would say I'm against it, and I'm much more on where Natalie's at in the way that I think that it should be in a rehab. It should be much more controlled.
So you're not
right?
against it. You're just wanting to be somewhere else.
This is where the discussion is. I think the discussion doesn't. I think the whole thing is that what they've done is what you've exactly said. In my opinion, is they've acted to a massive drug debt. They don't know what to do with it. They don't have a clue what to do. They're clueless, and they've just went, let's try something, and they've just opened a safe consumption room. Not really thought it through, and I don't think they've had the right people run about talking about it. I could be totally wrong. I know there's a steering group now behind it, which has got good people involved in it. I don't know where that's going to go. Do you know what I mean? Like, hopefully it could go like good into ways where you're going to start getting like rehabs and stuff with tiers, and you can get in, because obviously, and to get into rehab now, in Glasgow, I think there's a 28 beds or something, which is
the
mental.
Wonka golden ticket.
It's insane. It's like
bad. So how many beds do they have?
28 beds for the whole of Glasgow.
20, less than 30 beds for the whole of Glasgow.
It's insane.
And is that just for Glasgow, or do you have people for like Greenock needing their
no,
beds?
that's the full of Glasgow.
Full of Glasgow, but funnily enough, like the best funders through ADPs are like Fife and stuff like that. Your more rural communities, they're
middle
better,
class
yeah,
places
they're better
seem to be getting better funding than the places that actually need the help.
Fife isn't a middle class place.
At the same time,
you know about the poverty in rural Fife, mate, you wouldn't be saying that.
I was visiting a rehab in Annisland, and one of the lasses I got talking to in there had been referred into that rehab for Leicester.
Right, so they are giving beds to people from outside.
So it's no, the reason I was just giving Glasgow beds to Glasgow people.
Aye, because I know that Glasgow's health board's actually Glasgow and Clyde, so that's why I was like, so people from Port Glasgow, because it makes it a lot. Glasgow's already massive, so does it make it a lot more competition for the little amount of beds? Is what I'm asking basically. If you
but
want,
it's not just your controlled area.
Aye,
That's
and then
why
it's that, and then outside
chaotic in Leicester. And when she got a rehab bed, it was in Annisland.
And the thing is, and if that helps that lassie and she gets saved in that, she doesn't die off it, then I didn't care where her postcode is. But I'm definitely on the side of you, Natalie, where it's like that, them millions would be better spent propping up an already failing rehab system, right? Yeah. But off of the back of that, I would also say that rehab isn't for everybody. And just because it might have worked for you, doesn't work for the next person. Right. So it's like not a balance. It's like so what is the best use of the money? Propping up a system that isn't for everybody and is already failing, so you're throwing good money after bad. I think the rehab system has to be there, but is that even being run the way it's
something that we talked about earlier?
Beneficial for everybody.
Services are disjointed, right? we need to work to bring all the services together
the
so that
silo
all the
working where
services
everybody's
are
got their
working to the
aim behind.
best for the people that need the services. This bouncing one person from one service to another service to another service, and they're waiting 3 weeks every time they get bounced, that's not helping anyone.
So how would you, I would ask both of you, right? So how would you achieve that? And could the safer consumption rooms be part of your plan to have the services as all joint up services, but with the safer consumption room where it is and how it is, but as part of a joint up service? Do you know what I mean by that?
I know what you mean, and in that local area where that safe consumption room is, it might help that local area. But it's not going to help people in outlying areas if they've not got access to that.
That's like my
services need to be everywhere. We need to be looking at where is the problem, and all the services need to be targeting that area.
What if the problem's everywhere and you can't have 3 million for a safe consumption room everywhere?
The problem is
everywhere.
The bottom line is
point.
The problem is everywhere, and you're right. Like, not everybody wants to stop using.
No.
So at SISCO, we're not an abstinence-based service. So we're trauma informed, trauma responsive. We need to recognise a wee guy might come into me and say, Natalie, I'm cool on my meth and I'm all right smoking green, but I want to put down using smack and I don't want to use coke anymore. So we need to support them with that. Whereas you might come in and say, no, I want to abstain, and we need to.
Everybody's journey is different.
Everybody's journey is different, right? And that's what we do work in silos, and it's so frustrating because, see, in Scotland, right? Like, we've got guys like you that go into academia and you write probably fantastic papers, but we put them on a shelf, right? And nobody gives a fuck, right? But they're so...
Thanks for tearing my career to bits. I'm sad now.
Like, what I'm saying is, you'll write something that's absolutely fantastic, and to me, I'll read it and it'll make sense because I'll be like, oh my God, that makes sense. Like, I get that. Because for me, like, I need you to roadmap something for me so that I can go, right, okay, that's a cost-benefit analysis. That makes sense to me. Right, they people are going to get help. They're going to get supported. They can stay on drugs they can use. They're not going to go to jail for that. Like, that all makes sense to me. But every academic that I know that's wrote a fantastic paper, it's went on a shelf somewhere.
100%.
And the civil servants are only, they're feeding, like, no disrespect to any civil servant that watches this, but all our ministers is only as good as the civil servants that's providing them the information. What the fuck are they getting provided? Because the bottom line is, it's not anything that we're speaking about or we're sharing for our service users. I don't know if they're sitting in the most privatised residentials listening to the most pocket line people, white collar people, to look at solutions, because they're not going into POSO or Barmulloch or Easterhouse, or they're definitely not going into mass schemes to say, what is the solution to the drug problem? What is the solution to, like, prisons being overpopulated? That's not what they're doing. It seems they're going to white collar people and asking, how do we eradicate or fix this? They're not coming to me, they're not coming to us and saying, right, let's all sit in the same room and say, how do we eradicate this? Reduce the numbers, help people get well, or help them stay unwell but get a wee bit better than they are. They're not doing that. So we're coming on to podcasts to sit and talk about it in the hope that one fucking minister will listen to it. So here's an example. Last week I'm in my work, Springburn, one of the most disadvantaged areas, as you know, because you'll have done all your reportings and findings on it. And I had a politician come in to me saying, there's a close across the road phase that occupies 6 tenants, and currently the landlord can't get any tenants in it. Because what's happening is that's where everybody's going to use. So it's got all discarded needles. They're putting new security doors in. Kicking the doors in, no bother, right? Because it's round a wee bendy corner in Springburn. So it's very, very hidden. They're coming out to me and saying, what's the solution? How do we fix this?
Well, first I'd say fuck the landlord. Tell him to hand the houses back over to the council so we could get families in there. But over and above that, like, nobody knows what the solution is.
So that's what I'm saying. Politicians don't even know what the solution is because they're coming to me saying, and there's a safe consumption room. So they know there's a safe consumption room, but they're coming over to me. I'm a fucking nobody really in the grand scale of it, and saying to me, how do we fix this problem? I'm like, you've just invested 2.3 million a year in something that's supposed to eradicate the problem, but you've got a small cohort of people in Springburn. Now, I'm not talking about 5 or 6 needles, by the way, because when we went over, they've housed a couch up to the second floor in this close. So that's what they consider in a bogging close. That's what they consider as somewhere that's safe.
I think, see, the perspectives you guys have got, which is unique. The two of are like very good speakers, articulate. You've got education behind you. You both grew up in very, very like extreme poverty, kind of areas, really rough. Springburn and obviously yourself, Muirhouse. Now, Muirhouse is obviously based train spotting and all that's based on Muirhouse, right, and stuff like that. Do you honestly think, John, like the guys from Muirhouse that you knew would have used a safe consumption room?
I don't know, right? Like we spoke about this during my last podcast again, right, where you were asking that, and during the time when where I lived was this AIDS and heroin capital of Europe, I was a teenager, so I was at kind of I'd say the later stage of my teenage years, earlier sort of stage of my sort of starting to sell drugs, but I wasn't selling smack or anything like that. And starting to take drugs, but again, I wasn't taking smack or that. So I wasn't moving in the circles where I would be able to even have a thought process. If I'm being honest, probably no, unless it was right in the middle of Muirhouse, right? But what I would say is, people used to know think the safe needles, the clean needles scheme would work, and they would be like, it's encouraging people to take smack. We've got to have smack through the smack was already through the roof. But people will be taking it through the roof. We'll end up with hundreds of ODs because we're giving them more needles to take more drugs away. We're going to end up with the area round about where they're getting clean needles away. There'll be a massive crime rise and there'll be hanging. Places already fucked up with crime. Like, what are you talking about? Just give the guys their clean needles and let them fucking live. Stop all the AIDS and stop all the Hep C that everybody's catching. It's wiping out devastating families. And it was just always but there'll be there maybe will be a trade-off where there'll be some things that are worse. And I just see the same with the safe consumption rooms. Do you know what I mean? Like, there is a trade-off and it can help everybody. There was only certain, in the beginning, there was only certain chemists where you could go and get your clean needles for, or the local health centre. There wasn't one in every scheme, but you would have to travel. Like, for instance, Royston didn't have one, so you'd have to travel for like Royston or Granton, all the way up to, I think it was Craig Royston on Pennyville Road, the health centre there, where you'd go and get your clean needles. But does that mean we need to give people clean needles? Because if you lived in, I don't know, Clarmiston, and you'd need to take a bus to get your clean needles, like, no, they maybe never got clean needles, but some people did in the worst affected areas. See, and I didn't think the city centre's the worst affected areas. If it was me, I'd have it in North Glasgow, or, you know what I mean? There is areas, bits of Dundee.
There's another side to having it in one place.
What's that? Sorry?
There's another side to having it in one place. So different areas, different schemes don't like each other. They fight with each other.
It was definitely worse in the 90s.
If you need to go into one place, you're going to come across people from other schemes that are going to that same place that you had a fight with last week, that there's still grudges. So that's going to put people off.
100%.
You know,
you could get drug dealers and that and all waiting, and people, like, if they owed them bills and stuff like that, and if everybody was you, I mean, you know what I mean? It's there's so many variables to this.
You didn't need to get them there. Like, see, when somebody's due somebody money for drugs, they just wait outside the local chemist because they know they're going there for their methadone. But it doesn't matter about the safe consumption rooms. Already know where to get them every morning.
But if that person's jagging coke, I'm not talking about. I'm just meaning,
just in general.
Like, in general, like, there's so many variables, like, where you could go. He owes me $3,000, or he uses that safe consumption, because you know yourself, people talk, and this is what happens on the streets. People talk. Davey uses that safe consumption. All right, go down and get him in the morning, and then grab it. Do you know what I mean? So there's so many variables I don't even think they've even looked at. Which is, I think they've jumped into something very quickly. No looked at it again. I would agree with Natalie. I would tend to agree with, like, there's so many good papers for, like, yourself, people like Sarah Armstrong, and the people that really have you know how high regard I hold you and John with stuff. But I think you just don't get listened to enough in that academic. There's a lot of people in there, and you'll probably see it a lot more than me. You'll get accepted, but there'll be some people that will still be like that. there's so many lovely people that you meet in academia, but they'll say, I don't know, I've never had that.
Aye, but then that's why, as my understanding, why they have guys like myself, guys like Scott McMillan, who's also done a lifer, who's has PhDs on people, on things to do with like licence conditions and interactions with social work and stuff like that, because he's got lived experience of that. So it's more likely that he'll get listened to, and there hopefully be some policy actions off of the back of that. Myself and my background, hopefully be some policy actions, progressive policies off of the back of whatever I find. And like Natalie's saying, you're quite right, a lot of the stuff just gets put on a shelf. So also finding a way taking that sort of high level academic jargony speak that we kind of have to write in, and then bringing that right down into things like blog posts, briefings that local services can use and stuff like that. And that's on us in academia to be able to do that. But the ones with lived experience, who were more likely to go, but we're in touch with both sides. Do you know what I mean? We're able to see like
that's the unique perspective,
and that's my understanding of how we've got a wee bit more like.
Do you think it's do you think there's movement in it?
The fact that I'm there in the first place, mate.
No, I mean, that's movement. That's what I'm saying. I get asked.
When you say that, the fact that you're there in the first place, there's a lot of what goes on at the higher levels that I think are tick box exercises. So, like your safe consumption rooms, talking to people with lived experience. You know, this is so that they can say, we've done this. You know, we did this, we brought this in, we did that. Look how good we are. You know, are they actually doing things? Taking your advice, taking your experience, and actually moving on that experience, or are they just talking to you?
They might be or they might not be. That's the thing.
No, I think that this is sorry, button, but I think with John, right? John is. I think John won't let that happen. I think he's different. I think he's different in the way that he won't let them shelf his work, and they won't. This is where I'm looking forward to John going on and thinging, because I think he possibly could be the first person that's working in academia, working with kind of like high academic people, and I think you don't take no for an answer, and you don't.
So, you know and that's again the only reason I'm here. So I went back. I never went to school or that, so I went into jail with no education at all. And they says I wasn't allowed to do a degree because of that in jail, and I was like, nah, fuck that. And I just badgered the life out them until they gave me it, right? Went to Castle Huntley, they're like, nobody gets to go on a university placement. Badgered the life out them, went and done a law degree. I go out of the jail every morning to go to university like a normal student, and got a law degree, and then off of the back of that, got a PhD and everything else. Started my own non-profit organisation, because I think you're totally right. A lot of it is a tick box exercise where they'll kind of listen to you, but at the same time they're like, I've got all my own sort of their own shit they're trying to do, their own stuff they're trying to achieve, and not one bit of that is involved in helping guys like us.
Yeah.
You know what I mean? Not one bit. It's all about getting status for themselves, a position for themselves, and money for them and their family. Being in, like I think you said it on one of your pods, if you look at the sheriffs and that are in power and get things, all of them come for like, they get $100,000 a year, and they're all like the richest people in Scotland and that. They're all trying to achieve that. They didn't care about, or if they do care about people dying on the street, that's secondary to what it is they're trying to achieve. So they might not listen to me. You know what I mean? And probably won't they? So that's why I'm trying to get myself in a position where I can make the difference, and it doesn't matter if they bring in policies. I'm the one, or I'm trying to employ people to come and help us, to help people.
So the more we've got out there, the more chance we've got of being listened to.
But and like yourself, not just me. Like yourself, you're out there doing it. Natalie's out there doing it.
I've got sheriffs.
Cheers, John. Thanks for mentioning me there. Know what I mean? Like,
I've got sheriffs that are working with me that are of the same mindset as me and what I'm doing, and there's sheriffs that just aren't interested, like you're saying.
But I think I find when you catch, right, so say you catch one of them across, say you catch one in the back corridor, they'll tell you, we know it's a lot of shit, it's no working, blah blah. But then you'll see them on a meeting, or you'll see them at hanging. You're like, they start reforming into like and becoming part of what the problem is again, and you're like, I spoke to, but it's not a vote winner. I know. No, I know.
It's not even just about votes and that with them, right? They do have their own positions and their own shit they're trying to do, but they're also wrapped up in their culture and their way of doing things, and that's really, really hard to break. Just like we've got our own culture,
No, I get
And then
it.
we're in subcultures of
I
that
get it.
culture, but we've got our own thing that we're kind of like, nah, like fuck them, you're trying to do what we're trying to do and we didn't care what they're after. They've got that culture as well, but that's...
No, I get it. It's different. We don't get, like, the way we go, oh, they don't get us. We don't get them.
Aye, the same way.
I know,
And
I know. And you do need to understand that, I suppose, to an extent. And it's hard because it's them that make the decisions on us. We don't. It's not the opposite way about. And I always say it, and I say it all the time, the working class people, we're the ones with the real power. We have got so much power. See if we just down tools, they don't have anything.
Oh mate, I'm
Do you
all
know
for
what I
a
mean?
general strike over just about anything. Like honestly, if everybody was just
I'm there, I'm with you.
Ah,
I'm
you
like,
know what I
I'm
mean?
totally done with politics.
Like,
at this moment in
I'm so
time.
horrible to see, like, and I'm don't want to go into this because it's a different thing, but we're so divided on everything, and even that, like, you get people I'm no way to, no, I've done enough, and I'm like, in I'm no way to kind of talk, and no one to, like, maybe no one to talk, but I can't say this because I'm working with this organisation, and I get it because they're on their journey. They need to watch what they're saying and all that. But this is where they've got us all divided, like, because they've divided us that much that we're kind of fear to break into what we need to talk about. Do you know what I mean? And it's hard because.
But that's something that's right across society. You know, people are scared to say what they feel, what they really feel, because freedom of speech is no longer a thing.
Aye.
And because of an employer, like, I've got a lot of friends that work for the NHS, and a pal of mine actually a couple of weeks ago said to me, Natalie, I'm actually scared in my work to say I'm abstinent. It's almost like a swear word because I'm not allowed to say that I'm abstinent. It's all about like harm reduction and the MAT standards. And that's another thing, like, see in Scotland, we're good at putting sticky plasters over things. So Peter Criken, on the back of Peter Criken, bought a van, old ambulance, done it up, parked it in the most chaotic bit of Glasgow city centre, just at this run for the St Enoch's, and says, I'm going to park this van for anybody that wants to come and inject. Against the law. Paul Sweeney backed it, other politicians backed it. Glasgow City Council, absolutely not. We're going to make sure the police are there. We're going to arrest you. We're going to arrest anybody that's coming in and out of it. So initially, right, our society in Scotland said, we are not for that. That is not good. We're not doing it. And that's because a lived experience person says, there's a solution. I'm going to do this because it's the morally righteous thing to do. This is where everybody's injecting drugs. So I'm just going to put a van there and make it safer for people. No, definitely not. Then 2 years later, we decide, do you know what? Let's invest money and do safe consumption rooms. But we'll just do one shiny safe consumption room, and there's only going to be one service in there that you can refer into. So it's been open for a couple of weeks. There's 300 people in the first week, we're saying. We've not had one phone call, one referral, and we work with the most chaotic people right across the board.
Are they saying who they're referring to?
Well, I think the referral source is We Are With You. I think We Are With You are working from there, as far as I know. But We Are With You, what is that?
The old addiction. So it's the old addiction. We Are With You. It's a drug and alcohol service, and they work with all tiers of people, outreach, in-house service, similar to Phoenix Futures. Very, very kind of similar work they do. But honestly, I can't say enough that I just don't see. For me, if I'm going to go into something and that you've got the word safe attached to it, but then there's the implication that I'm still going to get done for possession, that takes away the element of safety, right? Also coming from absolutely chaos in my childhood, where I was told, you don't speak to social workers, you don't talk to the police, all the anti-authoritarian things you were told as a child. I'm going into a safe consumption room and it's social work led. That's also going to be a massive barrier to me.
I never knew that.
Social work led as well, right? So you've got all your social workers in there. Then the third thing for me is, for anybody that's intravenously used cocaine or even crack through the pipe, it's the most mental drug you will ever use. So it's literally a 5-10 minute high. It's just a and then you're back to reality, right? So it's not like a bit of kit where you're maybe going to be gouching for a couple of hours and then you're needing another charge. This is instantaneous. The minute it's worn off, you're chasing another charge right away. But the mentalness of it is you go into psychosis with it. So see when I'm using crack, if I'm dragging or smoking in a pipe, I don't want to go into a safe consumption room with strangers and social workers and people. That's not safe to me. I'm going to be in my living room with my door shut, probably the couch or something against the door, and because it's a mad mental
drug.
Is
that a social thing, Natalie? Like, it's also as well, like, obviously, like, you've got, like, a pub is essentially a safe consumption room for alcohol, right? Like,
I was going to bring that up.
It's a safe consumption room for alcohol, right? So, you're not allowed to drink the street, so like they allow you to go in there and have a drink. So essentially, it's a social thing, right? So I don't know, as a kind of IV user in your past, Natalie, is there an element to like a social aspect to it, like when you all sit and you've got your pals and you're all using the same kind of, do you know what I'm talking about, like when you're all
or is it a very lonely?
Is it a very lonely? Is it?
Not with cocaine. It's not. Cocaine is like, it's smack and coke are very, very different. When you're intravenously using heroin, you can use with other people, right? Because you'll gouge and then you'll wake up and you'll sit and talk absolute shite, and then you'll use again, and then you'll talk about going to get a turn. Cocaine's very, very different. It's a psychological head fuck drug. Like, and I'm talking about you go into mad mental psychosis. My experience of using it is I would put cups on top of a door and all that with a wee bit of water on it. Nobody in the house, the door's locked, but expecting somebody to come through my door. You're constantly at the windows, pure curtain twitching all the time. Like, psychologically,
the fear into you can't, like, everything.
It fucks your head up, and especially, like, we don't even know what's in drugs now. So I think when somebody says to me when they were washing back a bit of coke, they get a 0.2 on it. So there's nothing in it. Do you know what I mean? So you're out grafting all day potentially to get enough just for one. It's fucking mental, man. It's absolutely mental. But the connotation of a safe consumption room is somewhere that's absolutely safe.
So do you think it could be a safe? See, like, if they had them, and we were talking about having them in all the different areas and the main areas, where do you think that there could be a kind of an argument for it being an opiate, and rather than like?
What I would say to that, Sean, is if injecting cocaine is chaotic, I would be more saying that we should be aiming more for it to be for cocaine, because if it's a kind of drug that almost 50% of people are dying for, right, and opiates is obviously a lot more, right, and it's as chaotic as that, where you go into psychosis, you're a danger to yourself and others. A safe consumption room, to me, would be the best place to have somebody like that, because they're got to be in crisis. Like that, these are the people that are, and if it's not a social drug
or something, then, because you would just be hanging about.
That was my understanding. A safe consumption room was people could go in
and help
and be safe when they're in that
in crisis.
You know,
aye.
That was my idea. I know.
I mean, I think you should have it also in rehab, and the rehab's already got the facilities there for it, because there's already people there. There's already they've got their buildings. They don't need to go and source anywhere. It's already there. So there should be an aspect to that in rehab. Like, I agree with you. So, like, that's
I've never thought about it. Could be obviously, like, see the work. Honestly, I mean it, like, and I'm not working with people that are working with, like, but I work with people that like tier 1, 2, which is people that are kind of stable, or maybe just recreationally using or whatever. People maybe using just a bit too much. Just no chaotic, right, things. But you do get them now and again, but mostly. But if you're trying to, like, get, no, we don't have the power to get him into rehab, right? The only people that's got power to get people into rehab are statutory services, right? So, but see the work that somebody needs to put in to even, you would even go, you're ready to try and go to rehab, like the work that they need to put themselves in, how long they need to abstain, how long they need to, like, attend services, how long they can't like, there's so much they want to see before they'll even consider you for rehab. So see, like, you
to be considered for an assessment for rehab, you need to prove that you don't need rehab.
Aye.
That's how it seems in society at the moment. You need to prove that you don't need rehab in order to be considered for rehab.
So safe consumption rooms already, I don't know what you'd even call that, and the sort of mindset and the thing are already very different for the sort of rehab setup. You know what I mean? But it could be, if you have it on site, it could be a stepping stone to get people into rehab.
Yeah.
But if you only have how many beds? Was it
20.
Less than
Less than
30.
Less than 30. Sorry, I thought it was
I think it's
40.
28.
28 beds. If you've got 28 beds, you didn't have the fucking the infrastructure for it already to even have that. Is there?
You need you need, and I'm not. This is me being like hanging, but you need at least 1,000, like at least, and I would
There
say
are
more.
new rehabs opening up and down the country, and just because you're from Glasgow doesn't mean you need to go to a Glasgow rehab.
Right.
You know, if you are selected to go to rehab, you could
Could
end
be
up
anywhere.
anywhere in the country.
Aye,
You know, it's not necessarily going to be on your doorstep.
Let's just do more prevention work in schools. Let's get the thing for most frustrating thing for me is why we not doing all this prevention work in the schools. We're waiting to let's get a cure for this.
Aye.
We're not going into the schools and talking about Bramazalam or all these new drug trends, or we're not teaching the kids about we're not
because
going.
there's Wayne's kind of about like with the
All these new
vape,
gases,
all these things.
the
I don't know
vapes,
about it, but I've seen it. Like
the things that my Waynes can show me on their Snapchats is absolutely mental. And I'm
Aye.
very, very open to my children about drugs. We speak very, very openly. I always say to them, if you're going to go and try it, going to please let me know first, make me aware. You know, I don't say to my kids, don't use drugs because I use them. Like,
Aye.
absolutely no, I wouldn't be a hypocrite. But like some of the things that my Waynes, like my brain will come down and go, Mum, what's that? Do you know they call it blubs, but it's like the gas they're all taking?
no,
No, I've not seen that.
The hydrogen.
Cool whips. Must have seen cool
is
whips.
it just
Balloons.
NOS, just nitrous oxide?
Balloons, is that what you mean?
Aye, the balloons, they
Balloons,
call
is
it
it
blubs.
NOS?
Aye.
Aye.
No,
right.
It's a cool whip.
It's them, it's K, it's not Pink Panther, which is like pure MDMA. Like that's no, I'm like, kiddo, don't fuck about with that. Like
Aye.
that's insanity. It's, do you know what I mean? Like it's very, very frightening, but my kids have got me to educate them. See all these wee guys that are punting things and putting things on their Snapchat filters. Their parents are probably oblivious to the shift in the drug trends. What they won't know. We're not going into schools and saying to schools, we've got a massive, massive change in drug trends in Scotland. This is what's coming in. This is what to be mindful. Like the amount of like edibles,
Aye.
the THC fucking vapes that looks like Smarties and Skittles.
Somebody
And
just died there with a red THVs.
it's
the first time ever.
insanity.
Look,
It's
Somebody's
insanity.
first time ever somebody's died with cannabis.
Two in Airdrie.
Two people died.
So see, for me, like safe consumption rooms are great, right? But I need more preventative stuff for the Waynes now, because I don't want to wait until somebody's 30 or 40 or 50 or get them into a safe consumption room. I would rather get wee Sean, wee Natalie. I would rather get one of us in primary school and say it doesn't need to get to that.
And it's
But
not
there's
even
always
it's not even age related. Why are we waiting until people are in crisis before we're helping them?
100%.
You know, why are we not helping them at that early stage so
Because
they
we've
never
not got
get to
past
Does
crisis?
that not take
But we
like
don't
it's
have
obviously like
capacity.
the personal responsibility, and I don't mean this, but in the way that it takes a long time for you to start maybe admitting that you're an addict.
Aye.
So
Yeah.
to me, right, I watch. I'm only saying like people go with stats that are going through services, and we use stats and we say, oh, this is how many people are addicted to drugs and alcohol. Not, we're not even touching the sides because. There's so many people out there drinking bottles of wine every night and don't know they're an addict and taking Codamol every day and taking like whatever. Like,
Listen, so see for me, right, sorry to cut over you, Sean, right, but for me, there should be preventive stuff, right? But there's addiction in every sphere of society, but the problem becomes when you can't afford your addiction, or when your addiction has to be your everything because you didn't have much other outlets for anything. And that's why your areas of the highest rates of addiction are in your most poverty-stricken areas, your areas with the most deprivation. All your middle classes and upper classes. I was in contact with people that were taking and buying drugs and that for years, and they're everywhere. They're only just in Postal. They're only just in Craigie up in Dundee. They're only just in North Edinburgh. They're in your Barntons. They're in your Newton Mearns. They're in your. Do you know what I mean? They're in all your bits.
It's just
I
it's a
remember
lot.
this boy.
It's a lot more hidden into it. It's just a lot. Not even hidden. It's just a lot. Like we all know, like
It's not
lawyers
the
and that.
same
Lawyers
chaos.
and that. Lawyers and that. It's no
For people that can afford to
they're not
keep
getting
their
the
habit up.
jail.
They're
and
not
they're not
committing
getting-
crime. They've got the door, haven't they? They've got the door to
They're
fund
committing
it. And they're
different crimes.
social users.
Listen,
Aye.
they're committing different crimes. Right? So the House of Lords have went and tested all the toilets in the House of Lords, and every single one of them, even the private ones, all had traces of cocaine in them. Like they're all of them, mate.
I know.
All of them, they're all at it, right?
Surprised me. Do you know what I mean?
They're all at it, right? But they're committing different crimes to pay for their drug habits, massive VAT frauds, giving contracts to people that shouldn't have them for a back payment or whatever. So there's the crimes are happening everywhere, but they're invisible crimes, right? The very visible crimes are the ones that are constantly reported in the newspapers because it suits them. But we'll not get into a
No, I know, because
conspiracy thingy debate here, right?
It's true, but
it's addiction's everywhere, right? Addiction's everywhere. Alcoholism's not just massive in Scotland; it's massive across all societies, right? And
Western,
it's very
Western,
Western societies, right? But it's all right for your middle class mum to come home with 2 bottles of wine and tan them that night while she's making dinner, and then when the kids go to sleep, and then waking up rough, and then going into work late or whatever because of their own flexi time in their jobs, and it isn't one of their jobs, they're on a salary anyway, and it isn't one of their jobs where if you didn't turn up to stack the shelves at Tesco, you're getting sacked. You know what I mean? So addiction's everywhere. It's the impact of that addiction that's the issue. So, and I mind saying this to you, Sean, I think I've said that a few times. See, if I was still staying in the high-rise flats doing my bit, with dampness, with no fucking carpets on the floor and that, I'd be getting mad with it every day. I didn't give a fuck. I'd be on gear. I'd be recalled. I'd be back in the jail because I'd be like, fuck this, I'm just, do you know what I mean? I've got fuck all to do today. Can't get a job because of my criminal record.
So that,
do you know what I mean?
See what you're saying, John, that'll kind of take me on to what, obviously, I mean, you could cover this for 10 hours, do you know what I mean? But obviously, I was kind of wanting to speak about, like, people would maybe say, well, who the fuck are you to tell me what I can take and what I can't take? Like, I can take what I want.
I agree.
And somebody said to me the other day, and it was like, I told you the quote, it was somebody said that there's a thing called post
recovery
narcissism, right? And it was a term I'd never heard before, right? But I get it. I get that thing where, well, it works for me and my life's amazing now, and like so that's the way you do it. Do you know what I mean? And I don't mean, like, that's not even to anybody, by the way, because I've got so many friends on different scales that are all different opinions.
I know,
do you know what I mean?
them.
Like, I know, but there is, like, it could be a thing that, like, where there's people at high levels that think I can't take it, so everybody can't take it.
Listen, and that is, but I think that's how human nature is. See, if you get, like, so my route out of offending was education. And still now, I'm saying to people, listen, fucking get educated. And people like, I didn't have the capacity, I didn't want to go and read books. I fucking just get it done because it worked for me. And I still do it now. And even though I'm aware of it, I still do it now. And it's what I says to Sean as well. It's like people who go to the gym and start getting, like, feeling good and looking good about themselves. And one of my pals done it to me. He started being, I think he's probably got to watch us and be like, you fucking dick, put him on blast on a podcast. But he started doing, and he's really good. He was as big as me or bigger, and he's ripped now. He looks fantastic, and he's like, "See how you've got, like, dead fat in that? I could help you with that." And I could hang it, and I was like, what do you mean? I didn't think. I thought I was just looking and living well. Like, nah, like, I'll get you at the gym and I'll get you looking like me and all that. I was like, I didn't want to fucking look like you fucking dick. But it's the same as people who become vegetarians, people who become vegan. They love nothing more than telling you, by the way, this is what worked for me, and this was the health benefits, and this is the thing. Like, shut up, man. And it's the same with recovery, people who are, and then people who, like I was saying to you, in the jail, people who find God, and they go to hang, and it's brilliant. It worked for you, and there's some people who are off the fucking head with violence, and within a few fellowship meetings, are like, I know the guy you're talking about, he was crazy. Not too specific. There was another boy from Stirling, but and it really worked for them, and it helped them get parole, and they carried it home and they got out. Do you know what I mean? And it's like, that was great for you, but I'm not religious and I didn't plan on ever being. I know. And it's the same with recovery. I think there's people like that, and it's natural though. I didn't hold that against them because I think we all do it.
And as I think Gabber Matty will talk about it. He talks about it quite a lot, and he'll say like addiction obviously is like any kind of behaviour that in the short term will give that release, and in the long term causes you kind of damage. And he talks about, like, so I can't remember who it was talking the other day, but I think I'd big 5-0 and we were doing a group, and somebody was saying, like, do you think that you should be allowed. It was, I think it was a student, and it was like they said something like, do you think like it should be illegal to take drugs, or do you think you should be allowed to take drugs? And they went, no, I don't think they should. And I said, because they take up a lot of money, they cost a lot of money for the system, they clog up the system because they become addicted to drugs and that. I says,
so would you,
well, what I said, see somebody that's overweight and like can't stop eating, would you say to them that you don't deserve to go to hospital, or you don't deserve like your diabetes treatment, or you don't deserve, would you say that to them? She went, no. I went, so you're conditioned, you've been conditioned to think that drugs are a bad thing, when drugs are just an escape. They are.
It's poverty is a problem for me, and that's what my point was earlier. Poverty and deprivation is a problem, and if you didn't do anything with that, it doesn't matter how much awareness you do in schools, because cunts are still skint and cunts are still gone. Do you know what? That awareness thing that they done in the school was Barry. It was really, really good. But I'm still got to go and buy a bottle of vodka. You know what I mean? I'm still got to go and get melted in a field and take eggies, because like. Why the fuck no? Do you know what I mean? I've got fuck all. There's a
buzzword that they're using in the addiction services all over the place. Hope, right? If someone's got no hope, what's the point? You know, why try and change it? Because there's no hope.
And nothing's going to change. Because obviously, like when we talk about addiction, right? Like when you take that drug, that's the solution, right? So that there's already been everything there that now you've found something that's worked, right? It worked for maybe a month. Right, but it's worked for you, right? So now you're chasing that again. Because it did work for you, like that. You were free for that, whatever it was. So obviously, I wanted to cover trauma and that, because obviously trauma to me is trauma and poverty, right? But trauma and poverty are very much linked. You know what I mean, right? So, I think, the people. Gabber Matty says he's never worked with a woman, right? An intravenous drug user who isn't sexually abused, right? That's he says, and he worked in downtown Vancouver, which is one of the worst places in like Western society, and it's kind of like the wire that was in Amsterdam, right? So they kind of put on him in this bit. Gabber Matty still worked there for a while, and he says, I have never met an intravenous drug abuser who wasn't sexually abused, right? No, I honestly, genuinely believe this as well, right? And there's reports that suggest this, that over 80% of prisoners, right, male prisoners, no, it's a lot harder for males to admit just because the bravado and all that, but over 80% were abused, or like physically, sexually. So I think the point I'm trying to make is, like, you're talking about safe consumption rooms, or this is what the fuck does that do to actually get to the root problem of the traumatic thing that's making them go there?
So for me, I'll be brief so you two can answer that, but for me, it doesn't have to be linked to it, because that bit's about harm reduction, and that bit's about dealing with the immediate crisis.
Aye.
Over 1,000 drug deaths every single year, hundreds of % rise for the year 2000, where we used to only have like 150, 200, and in the space of a couple of decades, we're over 1,000 consistently every year, and there had to be something that dealt with the immediate crisis, and that's what they say for me. Harm reduction is what that is about, and then what Natalie was talking about earlier about the raising awareness in schools and having that has to be a different part of it, and it's a necessary part of it. And that also has to be there. And it's not about silo working, it's about realising that there's very different elements to this, to the drug crisis, the drug addiction crisis, not just the drug death crisis. And the drug death crisis is just a big part of that, to me anyway.
I know what you mean. So I get, like, in a way, like, the drug deaths is just a kind of like one of the factors that are across the board that we should be looking at that isn't working. Like drug deaths is basically the end result. That's like the end result of addiction. If you know what I mean, like that's like, so you go through addiction, the end result is death. Do you know what I mean? And unfortunately, we're going right. How do we fix death? And then you go, well, if you take it safer, then we might. Do you know what I mean? Like, so it's maybe been a reaction like that.
I think but I think again we're disconnecting conversations because conversations about trauma, school, consumption rooms, they should be all in the one room.
I think so.
Because the bottom line is, if we're not speaking to education about trauma and safe consumption rooms and drug trends and stuff like that, school can't put the preventative measures in place. I think, like, and I just gave evidence at Scottish Government in November as part of their massive findings because of a talk I had 4 years before it. The bottom line is that we all talk in different rooms. It's what we're doing in Scotland is absolutely not working right because everything's rising incredibly high. So that tells us we're not working. So whether it's SNP in power, Labour, Tories, whoever's been in power, whatever they're doing is absolutely not working. And it's down to an absolute disconnect.
Well, look at all us are well, I would know to say I had similar background to you two guys because I know you's hanging me and Ian maybe one is kind of chaotic and as you guys, I don't know, he might be, but like I certainly wasn't in that kind of environment like where it was like Muirhouse and like Postal and stuff. So that wasn't my upbringing. I didn't. I understand that it's different. So I think that the fact that we've got 4 people here, but that have all got lived experience, that have all got kind of like probable trauma in their life, have managed to get to a position where we're dealing with it and we're managed to help other people and stuff like that. But none of us have got an answer here for that. None of us have. But what we're able to do is have a healthy debate here about why there maybe should be safe consumption, why there shouldn't. And then you get, I just don't like, you'll get people in the government that just go, we're not talking about it, and Dorothy Bain, that's no my gig. It's got nothing to do with me. And when it is all linked, they're all linked. Like you're the head of fucking prosecuting people. So drugs is one of the biggest issues. So you should be answering questions about it. You should be. You shouldn't have the right to just go, you're a civil servant. You work for us. You should be. If somebody asks you a question, you should answer it. Do you know what I mean?
Nobody wants to look at the grey area, Sean. I think that's the thing. You've got your black and white and then you've got your grey area in the middle. And I think nobody wants to look at the grey area. Nobody wants to nobody wants to reconnect all the disconnected dots because they don't know where to start. But I can guarantee you, see if you put a group of 20 people with lived experience, academia or not academia, I guarantee you we could talk about a better solution than what they have that's existing. Because by the time I had finished 4th year in school, I already had 10 aces. And all my social work papers, so going through the redress process, all my social work papers say that. If you were to read all my social work papers, the primary one, all the way right up, they would tell you there's something wrong with this wee lassie. A friend of mine that's went through the same thing, his social work papers said he's in primary 2, he is walking around the school like a caged animal. That's how we were talking about children. So we need to be educating teachers. Social workers are not going to educate teachers, by the way. They're not going to do it because I don't believe social workers have adequate information or resources either about being trauma informed.
They work within a very hanged remit, don't they, social workers? I mean, I'm quite lucky. Like with my experience with social, I've good, but the remit's very like I don't know.
They work
tight.
within a legislation. That's the bottom line, Sean. That they're going to be black or white. They can't be in the grey area because they're part of legislation. I'm part of legislation at SISCO, but I'm also an individual person. So I can at times say, I'm going to put my professional SISCO hat aside and I'm going to come in as Natalie that's got lived experience and that's had a cunt of a life because I've got the right to have an opinion. I've worked hard to have an opinion. Like, I don't just come as lived experience. I had to go and get myself 2 degrees so that people would sit in a room and listen to me. Otherwise, it was just, there's Natalie with lived experience coming in to talk some amount of shite because she's got an opinion and did. So I thought, you know what, I'll go to uni. I'll go and do psychology and then I'll go and do business.
Got a stupid bit of paper just to justify your
just to justify.
To say the same thing.
Just to justify and say the same thing and maybe be heard just a wee bit more. Not an awful lot, but if I was to take away that lived experience and just come in as Natalie that had a psychology and a business degree, people would be like, I'm going to listen to her. The minute you throw in, so when I was giving evidence up at Scottish Government, and you had a DI, a PI, Sheriff Mackey, who I absolutely love, and we should have more Sheriff Mackeys in this world because he sees trauma, he understands it, he wants to do the diversion for kids, he wants to nurture young people. Like I said, I was the chief executive of a criminal justice organisation, blah, blah, blah. The minute I said I was lived experience, I seen the DI going like that and look round at me. And I thought his opinions just changed to me in a millisecond because I threw in that word, I've got lived experience.
Aye.
And that's the general consensus.
No, I think
there are people trying to change that. I'm part of a focus group now that's being run by the NLADP.
What's an
the North Lanarkshire Alcohol and Drug Partnership. Yeah. So they've started up a focus group of people with lived and living experience, and it's all about how to bring the services together. What do people with living experience want from services, all that sort of stuff? What would make it easier for people to access services? And we've only had 2 meetings so far, but they are trying to change things. Some people are trying to change things, you know.
Do you know we've been doing that for, not to cut you off, but I was part of the Carlton Athletic in 1997, and Davy Bryce and Davy Men that ran it have been doing that since 1997. So focus groups is nothing new.
Aye.
We've got everything for lived experience. It's just that we don't listen to lived experience. So the ADP, alcohol and drug partnerships, can create 500 focus groups. But see, the reality for me is, how much of our information are they going to take forward?
Practice,
They used to remember in the jail, you'd come to the jail and go
for the hall or for visits or for hanging.
I don't remember anything getting changed. Like, I mean, focus groups.
I got some stuff changed. Like, I got in Glencoe, all places. I got stuff to do with family visits and that changed. Got more stuff for the family bonding visits and that. Got them on different days. Addiewell, in fact, the focus groups for the visits there, Big Barry was fake Cumbernauld.
Big Barry, aye.
What was his
Barry
name?
McLaughlin.
Barry McLaughlin. I had a very bad relationship with staff up there, and for some reason Barry actually I don't know if he took to me in any sense, but he got me into the focus groups because I was always on family bonding visits, and anything we asked for, he went away and tried to get us in that. So they do work at that level. They worked, but like you're saying, like you have a million focus groups, and very rarely
when you're talking about legislation and that, and you're talking about like policy.
Your focus groups need to, if you're going to have a focus group, right, it needs to be attached to Scottish Government, and it needs to be ministerial led, right? So not civil servants. So it needs to be ministerial led, so that you're actually sitting there with the politicians saying, here is the problem. Here is your focus group for education, drug and alcohol, like justice, like everybody in the one room.
Multi-agency focus group, but we a minister.
It has to be multi-agency approach. Like, see if we continue to sit in silos, nothing in Scotland.
Natalie, see the day, me and Big Jordan, Big 5-0, we were doing a documentary and that, and about kind of drug deaths and stuff like that, and all about the drug epidemic, and hopefully that will come out soon, by the way, so everybody can get ready to plug that. When we were doing that, we were in an interview, and we actually went to see Anne-Marie Ward on the day that it was like the drug deaths were coming out, and the minister, I can't remember who it was, but she came out, she went half sick. So the day that she went half sick, and then this other big guy.
So would that.
I know.
If I was presiding over drug deaths and I was the guy responsible for them,
But this wee guy come on, obviously, like, it's just fired right. I never knew what it, and
he was an intern. He was only meant to be there to help photocopy stuff.
Ripped out the post room.
You couldn't somebody want to talk to you. Man. Like, how unwell are you, right? That you can't, like, you're no there. I get it. I mean, she might have not been well, right? But like, I very doubt it, right? But it's like she's actually went, fuck. I've no got answers for it. I don't even know what to say. That's how bad it's got.
She knew what was coming. She had a bottle of wine too many the night before. That's what I'm saying. Addictions at every thingy like that. Like, aye.
No, definitely.
And we know the year, but remember, we know the year before what the findings are going to be for that year. So they're already sitting on the numbers. And Anne-Marie Ward, like when it comes to things like this, Anne-Marie Ward, I'm very surprised she's not here today actually, because her opinion matters when it comes to things like this. She's got
Who's Anne-Marie Ward?
very,
I didn't know who that is.
she's the chief exec of Faces and Voices of Recovery, but she's very much an advocate for things like this. So she should have been on this discussing this today, because she's very, very informed when it comes to this, that she's worked at Scottish Government level around.
Policy level, and that's
very, very well equipped and understood when it comes to policies. So she should have been on this, giving her opinion today, because it would have been very, very valid actually.
I mean, I think this discussion's been great today. We've still got like a wee half an hour, and I'm happy to kind of, like, if there's anything that you guys feel that you would like to cover, or anything that you would like to kind of bring up and talk about, do you know what I mean? Because we've not spoke about prisons, right? And I want to cover that a wee bit as well. Like, obviously it's kind of different in the way that there's no really, like, it doesn't really matter with but do you think, because I was thinking in my head, right, I was just thinking that's not the way you think. I mean, I think they'd have a fucking safe consumption room in the jail we're in. Like, do you know what I'm talking about? Like, see if you're going to put it across society. Like, so obviously jail's different. You're not it's totally, you're not allowed. It's very punitive, and it's.
But like, I know even just that. So there's obviously bits that you know loads about, but I know hundreds about the jail and how they react to shit today with this, just for being in there for so long, right? Is they didn't even have the same harm reduction and public health approach to what's happening now. They'll still punish you for having drugs in your system.
Aye,
you know what I mean? Not even having drugs. That having an addiction problem in prison can lead to you doing 5, 10, 15, 20 years over your sentence. You get 10 years. There's guys in there. We guys that have got 18 months and 2 years in that, one of the LROs or OLRs, whatever they're called.
One of my best pals in there, like, I'm not going to say his name, but he got two rec, and he's done 18 years nearly.
18 years, and is that for addiction?
Really, aye.
So there you go. So they already have.
And it's not even addiction, John.
It's
not even like cocaine and all. It's like it's drugs that they would give them, right? It's drugs that they would give you
because they're taking it illicitly.
Aye, but it was if there's drugs that they would give you if you went and went, I've got a problem. Do you know what I'm talking about? So if you went, I've got a problem. But people are terrified. Like when you're in prison, you're terrified to go and say, hey, I've got a. Do you know what I mean?
Listen, the same
you're not going to get to progress. That's the bottom line. You go and tell them you've got a problem, they're going to say, right, okay, well, I can't progress you into society.
You need to risk assess that, and it knocks you back to where you're meant to be. And then it's the same when you get out and you can't tell your parole officer or that you've got issues. It took me. My house got busted and I got caught with Valium. It took me then to be like, I had to tell them about getting busted anyway because the serious crime squad were got to tell them. So I was like, oh, I got caught with 100 Valium. He was like, how did that happen? I was like, well, there's a story to that as well. My house actually got busted looking for other shit. And then I was like, I've actually, since I got to jail, I can't sleep. I've been having nightmares, mad anxiety, can't even go to the shop, so I have to take Valium just to get through the day. And right away he was like, why did you not tell me? I was like, because you're going to send me back to jail. He was like, right, maybe, but like, we'll try and help you kind of thing. And they were actually ended up being brand new. And it made me think I maybe should have told them about this a lot sooner. But it's the same in jail. Like, you're not going to tell anybody anything because right away it's like your LSCMI score goes away up and they're like, right, this guy's a risk. So you now need to go on this course that doesn't run until in 2 years' time, but your window's in a few weeks.
It's fair. Me and Sean know a guy that got 9 years and served 27. And it was purely because he couldn't stop using drugs. Then get out, his life licence obviously stipulates no drugs and alcohol because part of his crime. When he had a relapse, he was absolutely terrified to go to social worker and tell them. And I had to be like, you need to be transparent because the bottom line is if she clocks it without you being honest, she's just going to send you back. So I had to go in to the social work appointment so that I could help him break the power and him saying, I've actually relapsed. This has happened. And they could give him a wee bit of support because a licence condition is a licence condition, right? And if you've got a pure arsey social worker that doesn't like you, they're just going to recall you. Many times have you seen it or heard it? Like I've heard it hundreds of times for the boys.
So this is still quite a sore point for myself and probably Sean as well. one of my really close pals, the exact same situation, killed himself in like November there, because October, sorry. Billy Johnston, his name was, and
I'm sorry to hear that.
done his whole life for us, and he relapsed, and he didn't know what to tell his social. He was going. There's other shit in with that, but and he went away and he swallowed. It was something mad, like 20 bottles of methadone, and killed himself. And all because he was too scared to go to a social worker and be like, I'm struggling here.
And he was a boy who was very intelligent. Like,
He's a boy who got me into education, and he was one of the.
and-
He was what you're saying,
Aye.
post hanging narcissism. He was one of the
Yeah.
education worked for me, so it's got to work for you. And he got me up to education and Glencoe and that, and I never ever looked back. And he ended up going away to uni, doing degrees off the back of him. He was like a fucking stockbroker down in London or something. Come back up to visit his family and ended up being involved in a murder through in Edinburgh. Ended up doing a lifer, getting addicted in jail, having to hide it to his parole officer and that outside, for all the same reasons that we're
Yeah.
talking about here. And they still won't change their policies on it. They still won't, like, it won't matter. There'll be no come and go. There could be
No.
100 Billy Johnstons a month, and they would just be like, listen, like, well, didn't get addicted
Aye.
then.
So
Because
the-
you're attached to the criminal justice system.
So there's that stigma there, right? So there's that example of your pal, that stigma going to the social worker, going to authority. It's the same with the consumption rooms. It's the same with an intravenous drug user. See, like the thought of getting into a safe consumption room to use drugs,
being judged and
Aye.
stuff, and just like
being judged, the authority, the social work, it's a system, innit?
So
like
it-
But it's
we're
the same. So see, like
It's
what
a
I was
social-
saying about the
it's a-
sorry, Sean, the needle exchanges things, where people were saying the same for that. I'm not going to use the needle exchange or that. But the wee pockets are good at them. We're reducing things like AIDS and that. Is there any way where you can kind of see a connection with that, or are you just totally like, no, you can't? Like, do you know what I'm saying? Because you say people with the needles exchanges things that were only in certain places in Edinburgh.
I get what
I
you're
don't know what it's like in Glasgow.
I
Is it still
read
the
all
same?
I read all the
I get what you
research on the needle, and Fiona, a very good friend of mine, actually, she lost her partner AIDS during that time. She was from Edinburgh, so I do read the research. See, with this one, it'll be a case of prove me wrong.
Aye.
Aye.
And that's fair.
It'll be a
That's fair
case
as
of
well.
prove.
Aye.
Like, I've got my opinion
Mm.
as someone with lived experience. I've got my opinion as the chief executive of a criminal justice organisation, having spoke to guys in the jail, guys out the jail, guys in our service, guys out our service, guys at Selleck Park on a Monday night. Like,
Aye.
I've
I guess a
spoke
lot
to-
more than what I've
do you know
done
what I mean?
by
Like,
Googling it last night.
I've done a wide spread of right across the board, professionals, non-professionals. Where I'm at just now is prove me wrong. If you're going to invest 2.3 million a year for the next 3 to 5 years into something,
Better make it worth it.
you
Aye.
better make it
show us
work,
what-
right? Because we could be building less jails, more rehabs, and putting that as a proprietary tier into your rehab.
Aye.
Right, okay, we know that you're chaotically using, so we're going to build, I don't know, a small scheme of houses where we've got nurses and doctors that's
So
proprietary
realistically-
pre-rehab.
If there was no budget constraints and all that nonsense, you could see this system working if the right things were thrown at it. But the way it is just now, it's not working.
Or it's not likely to work, is what you're saying. 'cause
So
we
it's
didn't
not
know if
likely
it's
to
worked
work
or
as
not.
it stands right now.
Well, do you think it's like one place?
No.
One place?
No.
One place,
No.
no.
It depends what you mean by work, though. If as like
It's
for
gonna
me,
work
it's
for
not going
that-
to work for nobody in Postal.
that
It's definitely not going to work
environment
for
right there.
anybody in Edinburgh.
But it's meant
But
to be safe.
The AIDS,
so the
the
word
AIDS thing, and
safe,
that's
Word
the thing
safe
that's going to that's
isn't
hanging
broad
for me.
enough.
the
the
word
A-
safe, the
aye.
connotation of the word safe, right? If I
Aye.
hear the word safe, that means that I'm going to be protected.
Yeah.
No matter what, I'm going
Yep.
to be protected.
But they can't call it the wee bit safe
So
consumption
they should
room.
just call it a
The wee-
consumption
a wee
room.
bit
The kind
safe
of safe
consumption.
Just call it
No,
a consumption room. Don't
consumption
call
room.
it safe. There's nothing
Aye.
safe
Safe
about it.
fish on the days when they do
Aye.
warrant suites.
No.
See,
for
if it
consumption room.
reduces
Consumption
bloodborne
room, I know.
viruses in Glasgow, then fantastic.
Aye.
But
No,
the
that's-
guys
that's-
that do
I know.
the TikTok platform that do
Aye.
the streets,
Francis,
right?
Aye. Brilliant.
Francis, fantastic, because what he's doing is he's going to all your wee sideway streets in Glasgow, St Enoch Centre, all your streets, and
It's a
he's
subculture.
speaking
It's-
to the
aye.
intravenous
It's a
drug users
subculture.
Yeah.
in Glasgow, and they're
Aye.
saying, we wouldn't use it.
It's amazing, John.
I'm not going to use it.
He's
I've
good.
got
I'm
a
on
want out for
TikTok
me.
for that, so I
Aye.
don't
You
know.
I'll
should-
send you a couple.
Yeah. If
He's-
Sean sends you a
he's,
couple of videos,
he's-
tune into them because
He-
they're
he-
real.
He explains it in a way. He's got something about him. He's got like an aura. I don't know what it is. I mean, he's on our documentary, and he's just got an aura about him in the way that he's dead good at speaking, and he's more articulate than what you think. He is really good, but he explains it in as a subculture. and listen, my cousin as well. My cousin's at home at Central Station. Like, he can go to Central Station. He knows everybody. He knows everybody. It's a.
And it is. So see if they were to make it. So I don't know if you know this. So see when you're on parole or probation or on a, what's it called? It's not called community service anymore. But whatever.
CPO.
Not a CPO, right? If you're on something like that, do you know your local social work's like a safe space where they're not allowed to get the police or that to you, or they're not supposed to?
Yeah.
And the police aren't allowed to go there to try and get you for warrants and that. What if they made an exclusion zone around the thingy? Would you see that working around the consumption room?
No, because I think it's down to I can't shift. I can't shift a person's opinion.
Mm-hmm.
Do you know what I mean? Like, I can work hard to change my opinion on something, but if you're anti-authoritarian and you're against a system, then I can't change that person's opinion. Like, it's taken me 13 years to not absolutely hate the police and hate the system. And that's a lot. I've had to put in a lot of work, because all the people that I went to as a child to ask for help are the people that rejected me or branded me a troublemaker or this, that and the next thing. Do you know what I mean? So
is that because it's social work that runs it? If it was completely healthcare, would you be like, right, I can begin trying to work with that? No, even you can work with it, just I can begin starting if you take the social work with it.
I think if we take away the authoritarian element for anything, people will be more inclined to work with it. Even in the jail, you know yourself, like in the jail, you would be more inclined to come and speak to a non-white shirt, a chaplain, or do you know what I mean?
Know. How long did it take? I mean, I was lucky to be part of Natalie's. Natalie was the first person to open up a recovery cafe within the prison system. And
well done.
Obviously,
great,
I know Natalie was the first, and obviously I helped Natalie. So me and Natalie worked together, and we've done a lot of work together, and we had to fight like fuck to get the officers not to be in the room. Like, we had that was the biggest problem, because security, right? And security were like, no fucking way are you sitting in a room where, like, do you know what I mean? It's just no happening. Like, that was the way it was. And if it wasn't for Mick Stoney and other people, that wouldn't have happened. I don't think, like, I mean,
I'm going through the same thing in Addiewell now. I've just started a group in Addiewell for people in protection. The people in protection don't get access to any of the recovery stuff or anything like that. So I'm going in there with smart recovery for people in protection, and I'm not allowed to be in there without an officer in the room. They're not going to open up the same way as they would if it was just me. When there's an officer standing in the room. But that's the way Addiewell want it. You can't have this without an officer.
Like, I don't even know. I mean, I don't even talk. I mean, I don't know. It's just a different weird.
I think it's bad. Now, we were there in the first couple of years when it was a fucking war zone. And I think it's went back to that, to be honest with you. I think it was really bad.
I would push for that, though. I would push for it, because we've done a lot of work in Addiewell without officers in the room. But the bottom line is push for it.
It's taken me months and months just to get myself in there.
Aye.
You know, and I've
Addiewell don't like change, and
make assurances that this is a voluntary thing. I'm not looking for pay, you know, because they were like, oh no.
Didn't have it in our budget.
No. I'm not here for pay. I'm here to bring a service to people that need that service. That's all I want to do. And it's taken months to actually get the group up and running.
Take money off them. They're private. They've got plenty of dough. You're off your nut.
They're not going to entertain it if it's, you know.
I don't know. I think they're looking at therapeutic elements in jail. So I think if you put a proposal in a business plan, they might actually, because jails are chasing something that's working.
I think Addiewell's different, Natalie. Honestly, I don't see.
I don't know who the governor is in Addiewell now, because I've not worked in a couple of years.
It'll be some business manager, like when we were. I mean, remember it was like Angela and all that, and you were like, what degree? Like, I'm no Audrey Part was a good governor, right? Like, I for. Whatever she's done, right? She was. If she didn't come into Addiewell, I don't even know what Addiewell would have been like, right? Like,
Tony Simpson was alright.
Simpson was alright.
Some of the managers were alright. It's like, listen, it's like anything, and it's like the police as well. You get 90% of them are arseholes, and then you find the one that's alright, and if you can get them to work with you, and it'll be the same with what you're looking for. you'll need to try and ask some of the guys that you're talking to, even when there's a screw there, or even ask the screw. Sometimes they'll be to listen, who you need to go to this way, then they talk to him, her. She'll push that through for you because she's trying to make a career for herself, or he's trying to make a name for himself to push his way in this direction, and they'll give you a manager, and then you just have to talk to them and be like, listen, this is what I'm trying to do, this is exactly how I'm trying to do it, and this is why, this is the evidence behind it, and you'll maybe...
The last year that comes into the room with me, she does all sorts in recovery within the prison, and she's absolutely brilliant, and I think a lot of the guys, they trust her because she's involved in all the different recovery stuff, and there's nothing ever went back to, you know,
Andrea.
Andrea, aye.
Andrea's
brilliant.
Andrea's
really good. I think a lot of the guys do trust her.
But what happens if
She's still in office there.
She's still
in office there.
If Andrea
She's got a duty to do whatever.
She's still in office, so she's got a duty of care. If you're sharing something, she's going to go back to her. She's going to go back to her work.
If Andrea leaves tomorrow, I know, then you're...
you end up with the next last one because you've not challenged it, and everything's going on all the guys' intel.
But no, I mean, obviously, like so you, even a little. I'll ask you this, right? So see, like when you're doing like obviously arrest referral stuff. See, when you're going into these, going in and obviously you get told to fuck off quite a lot, and obviously people won't want to. That's the way it is. Do you know what I mean? And it's because it's always seen as authority, no matter what you. There's an element of we're seen if you're working with anybody, even if you're in partnership with the police, you can still hate, like you can still be against a system, but understand it. Do you know what I mean? Like this is where the problem lies. I think a lot of the time you're not allowed to have an opinion, right?
See, I find more doors open for me than open for the custody officers.
Aye.
You know, when it's the custody officers that pull that hatch down, fuck off, don't want to talk to you.
Aye.
When it's me that pulls that hatch down, they're like, oh, well, I'll talk to you.
Definitely.
You know what I mean?
No, definitely. I mean,
so I get a different response from what the police and the custody officers get.
Aye.
But I'm turning up there in my tracksuit, unshaven, you know, how you doing, mate?
Aye.
You know, I'm no in uniform, I'm no an authoritative figure.
Aye.
I'm just another guy.
Aye.
You know, which opens doors more than...
No, and I think it's like, do you know what I think the consensus is coming to here is just like, there's a lot of division, right? A lot of division. People have got their idea, and it's their way of the highway, right? With so many different things. If you've got people on harm reduction side that are like, we need as many of these as we can, and like we need to put. Now, that guy might be chasing a job, as you says, and like he might know that he's going to be the next guy that's head of harm reduction in Scotland. So he's going, I need these fucking things because that's going to get me that job. You just don't know. I think that where we can see is there's a lack of connection on where we're standing, who's willing to put like that grey area, right? That grey area where nobody knows, and the trauma, right? Trauma, poverty. These are the things. Now, I don't know about you, but like we've all got long left, right? So, but I go on Twitter quite a lot and I watch people think Elon Musk's like this, the saviour, and he's like this billionaire. No, I wouldn't trust any billionaire, right? Which is the only reason just because, like, why do you need that amount of money, right? I mean, there's that much poverty. Now, listen, I would love to be a billionaire, so it's like, I'm also a hypocrite in that way, do you know what I mean? But I just don't understand where this billionaire boys clubs came from that everybody's all putting their trust in. And I don't think any of these people that we've got, I actually said the other day, like, the judges, so some judges like own, like, I don't even know, like castles and mountain ranges and stuff like that, like things that you couldn't buy, things that like vast bits of land that you would be like, I don't even know how much that would cost, but they're on like hundreds. So how you affording that? Do you know what I mean? And they don't need to open their accounts and stuff like that, right? They're the only people that don't need to show you accounts. There's a lot of reasons why they'll tell you, but there is a class thing. There's always going to be a class thing, and there's a class thing. People at a higher class are going to get treated better in addiction. You're going to go into the Priory. You're going to go into the places like this. You're going to get much better help. You're going to get, and that is the fact that down the bottom, it's shocking now. The streets are terrible. That it's the drug trends have changed to an extent where we don't even know what who's taking what's in what. So where, as we're coming to the end, I know that it's an impossible question, but I'll just ask it, right? Like, I'll ask it cheesy. What do we do?
So I would revisit the change in prescribing policies around Valium for starters, for me, right?
Agreed.
You can see a clear thingy where in 2012, 2013, where they're like, right, the most you can get Valium now is for 6 weeks, right? For there to a year later, a Tizolam just bursting through the roof and everybody dropping dead. Like 70-80% of deaths of Tizolam related. Now it's, what's it, Brohamazam or whatever it's called.
Brohamazam and Fluprazolam and
call it whatever you want, but it's just the next to Tizolam, right? And if it all roots back to where they changed that, and then I would revisit prescribing policies around methadone to the point we spoke about earlier on, but I'll bring it on again here because for the sake of this conversation, where you've got, and I agree with the methadone programme for the 10 mil and the 50 mil, whatever it is a person needs, but there has to be a treatment plan around it where it's like, we're not going to put you on it for 20 years just for the sake of it, right? Just because it's a what's it called?
Gold standard.
No, a thingy where we're changing one addiction for another substitute.
Substitute.
I'm in a day, right? So it's a substitute for it, and we'll put you up to 150 mil or whatever it is you want, and we've got no plan of ever taking you off it or addressing the issues that got you on it in the first place, and we'll just hang it. There has to be
it needs to be used to keep a person safe while you work on
all
the
the
issues
other stuff.
and come down a reduction plan to the point where they no longer need it. That's what it needs to be.
But the only place that works is like rehab, right? I mean, you've got
it's
like
not the
that
only
therapy.
Place,
For people with trauma and that, I would argue with that, John.
It can't be the only place, because I know people that have got off of drugs by not going to rehab, by whatever the other ways are they doing it. Like, it's, you can't tell me all the people coming off of drugs are doing it with only 30 spaces in rehab. Do you know what I mean?
See, your ORT, what we need to remember is legislations around ORT with the NICE guidelines, and the blue paper stipulates when we started to prescribe methadone as an opiate replacement therapy, all the papers said that we must provide psychosocial supports in place.
Yes.
And we never ever done that. So what we done, it was just a script and go, there's your script, on you go, we're not going to provide the psychosocial supports. There is a place 100% for methadone, but we can't, it has to be short and sharp. It can't be just park, let me keep you on it for 30 years, and by the time I take you off it, you're going to have crumbling bones, you're going to be incredibly unwell, like you've got to wish you were dead anyway. You're going to wish you were dead anyway, because it's a painkiller. Do you know what I mean?
The Nicky people on it being like, I wish I never started.
Well, we've got a 62-year-old guy that's been on it for coming on 40 years, that's because he's like, I want to be clean, I want to know what it's like to be clean, and now that he's clean, he's like, I've never been in so much pain in my whole entire life. And I'm like, because you've been on a painkiller for 40 years.
We spoke about that with the Buvidal.
Buvidal is, the good thing about Buvidal is though, what they've done is, and I hope they maintain it, because they've done the same thing with methadone, is they've brought out legislation around it. Do you know what I mean? So what we're saying is, we're going to give you this, but we're going to bring you down. We're going to make sure every month we're seeing you. We're going to give you this injection. Like, we've got guys that's been on methadone that's not seen a care manager for 3 years that are on 120 mil of methadone, maybe 2 milligram diazepam a day. Do you know what I mean? Like, really chaotically, that's not seen a care manager. So like you're saying, there's a place for methadone, there's a place for consumption rooms. Let's take away the word safe, because I don't believe they're safe now. There's a place for consumption rooms, but we need to figure out where is that place. Because there's a place in Muirhouse, so there's a place in Cumbernauld, there's a place in Springburn Post, Maryhill, Easterhouse, Mulgai, Bearsden. There's people using in Mulgai and Bearsden. There's people using there's spaces and places for them, but again, if we continue to have disconnected conversations about your education, your justice, your drugs and alcohol, so we'll just segregate you all. If we don't bring everybody into the one conversation and say, right, how do we reduce this? How do we eradicate this? How do we do this better? Let's listen to John, because John's just wrote a really, really good paper on it. That's what we need to start doing, do you know what I mean? And that then creates the word safety.
Yeah. Well, I'll even put it out there, just because I know people watch this, right? And I would redo this, right? Well, way more people, right? Like, and we could maybe get
Get the ball Dorothy on
it. But even a politician, any politician that's watching that would like to come on and kind of talk about legislation and how it works at government level and how they see it, and it wouldn't be a fucking bushwhack job. Do you know what I mean? It would be like we could redo it in a conversation like this.
This proves that it can be done.
This has been to me, a very constructive, powerful conversation, and where it's educated me a lot. Like, and it's educated me, and I think it's for different angles. Do you know what I mean? I've been educated by.
But see, the question you asked me, can we get Ian and Natalie? Because you only answered a wee bit of my question. I want to see what you both think. Because I didn't know enough about it, just in case you end up finishing up. I want to know what they are.
So so just to find out, what would you? How do we fix it, Natalie?
How do we fix
just the safe consult? Like, how do we fix the what's the best way around about it? Do we get rid of it? Do you know what I'm talking about? What's the solution for it?
Absolutely not. I'm not a fan of getting rid of somewhere that's going to provide something that's potentially going to keep somebody well. But I'm all about keeping somebody well. So my service is, tomorrow I might go into work and I might need to be sitting in a room with a wee John with an naloxone kit for 6 hours to make sure that he doesn't overdose. That's the nature of my service. I'm about things that work, Sean, right? And what I see and what I've seen I've been using till I got clean, till I started studying, is nothing that we're doing works. It doesn't work. Everything's so disconnected. We need to have harm reductions. We need to have consumption spaces, because we're going to consume them regardless if it's legal or illegal, right? We're going to consume them. But it's about what's the most conducive spaces that we can create that is safe for people to use, that's not going to have I'm going to nab him for a warrant when he goes down because I didn't get him on that shoplifting, or I didn't get him on that domestic, or I didn't... Because there's nasty police out there, right? And although the Lord Advocate's saying one thing about, we're going to try and not do you on possession, see if I'm a copper and I've got a resentment with you because I've been choking to get you, I'm going to nab you outside that. Right. So there is a place. I'm not like harm reduction against recovery, because as someone that abstains from drugs and alcohol, I'm also about, like, how do we get that wee guy well? And if that wee guy chooses methadone as his wellness, then I'll fully support that. I'm not narcissistic, or, do you know what I mean? It's not my way is the best way. And because I went to rehab, you need to go to rehab. And because I done the program of Narcotics Anonymous, you need to do it. And because I do... That's not who I am. Definitely not. Recovery is no linear for me. Yeah. It's about what is your journey and what's going to work for you. But I think if we're going to call something safe, like at best be safe, man.
Know what the word means in that.
Yeah, at best be safe. I think for the consumption rooms, just call them a consumption room. Because for me, just now, there's not a safe element attached to it.
That's definitely changed because I come here not really having a position, but that's definitely something that I'm taking on as part of my position.
It's definitely opened my eyes a wee bit to
the safe elements.
My opinion's not the same now as it was when I walked in here, because that safety element has to be broadened. That safety element, if you're going to call something safe, it needs to be safe.
100%.
I think the consumption
rooms... stealing my last bit. He's stealing my last bit. The opinion, man. That was my last question. I
think consumption rooms can be part of the bigger picture.
Right.
But they're no the cure.
Right.
I think the harm reduction that's involved in it, there's people who are intravenously using who have got horrible infested wounds that can't get to see a doctor. If they can go into a safe consumption room and a medical professional could be there to say, come here, I want to have a look at that. That's going to help someone who would not get the help. Mm-hmm. If there's anything out there that's going to help people that are slipping through the net, I'm all for it. But it needs to be managed properly. It needs to have all the right things in place. Just saying, come in here, use and get out, isn't safe. It's no helping anyone. Yeah.
So, again, right, just to obviously, I will just finish up anyway, right? And I know you've kind of answered that a wee bit yourselves, but so your opinion has changed, John, since you've kind of a wee bit like...
My opinion has changed if I had an opinion. I'm no anti-drugs or pro-drug. I think anybody should be able to do whatever the fuck they want to get themselves through the day. Life's hard enough. without having somebody coming and going, do you know what, I didn't like how you're living your life, so I need you to be doing this, right? But I do think along with that, there obviously there's problems and there's risks with that. So I think I thought safe consumption rooms, I kind of agree with them, gave it a quick Google about what it was, looked good to me, and I was like, that's definitely, but after hearing Natalie talk about the whole safety element and hanging, I'm like, actually that doesn't sound as safe with regards to the sort of policy and that around it, or the legislation around it, or the lack of legislative change around who the police being able to come down and target drug users coming in and out, and how that's got to affect people being able to use it effectively. So it has changed my position to the point where that there's more work that needs to be done on the safety element and what safe means.
Definitely.
The word safe, and to apply it.
Because
I think, I think it's important. I'm very good at telling somebody I think you're wrong there, and but I also think it's important to say, do you know what, I think you're right there, because I think we all do. We all do that because we're argumentative by nature, to go, I think you're talking shite, and this is why I think you're talking shite, and you'll go A, B, and C is why you're talking shite, and we didn't enough go, do you know what? That's what you're talking. That's what you're thinking.
We've all got big voices. We've all got big opinions.
But I think it's important to tell somebody, that's changed my mind when you said that.
That's what I was hoping today, like, and obviously, like, so Natalie, what about yourself? Is there anything that's kind of changed your opinion? Like, you've kind of
no, Sean. I'm actually one of the people. I like people to prove me wrong. I like to be in a position to go, do you know what? Fuck, you were right there. I got that so wrong. But I'm never going to go with just a tokenistic value or something. I'm not going to go with something because it's shiny and glossy and it looks good and it's just a wee sticky back plaster, because the bottom line is I've lost too many friends and family to drugs and alcohol that I can't just go with a tokenistic value or something. If you're going to say something safe or it's trauma informed or trauma responsive, I'm not buying into it unless I know 110%.
What would it take to show you? Because we already know the statistics get massaged in that. So what would it take for you to
those
go,
statistics. So we knew somebody that worked in the toxicology department when the drug and alcohol, when in 2016, when the numbers came out and everybody was like, oh my God, the drug stats are incredible, we need to do something. The next year they says that the numbers had dropped like 12% or something like that. We knew the women working in the toxicology department that was coming back to us saying, the figures are incorrect. Here's the number of drug deaths in Glasgow every single week. So we knew the numbers were massively getting massaged. So that's what I'm saying about working at government level. Like, I know how they can massage stats to make them fit their narrative. So what it's going to take for me is a Natalie that's chaotically using coming back to me and going like that, do you know what? That's a wee safe consumption room down there. See, when I was down there, this is what happened with me. This is what they done. This is the word on the street is what I'm not going to listen to professionals, because again, that's just going to fit their narrative.
That's what's good about having a frontline service, because you've got access to that.
So we get to hear it from the troops, do you know what I mean? They'll come in and say to me, I went down there and used it and this is my experience. And I won't just listen to one. I'll listen to that collective view for maybe 20, 30 people. So what it will take for me is for that feedback.
I think that's fair.
Yeah, because then that's not my opinion. Because I'm 13 years removed away for using, but it's the opinion of the people that are in the chaos now. And I don't want to see people in chaos. I want my job is to see people well.
Coming in and saying, oh, I felt really safe, and it was like blah blah blah, and I know that I would
be like, brilliant. Okay, so it's a safe place because you are getting well, but that's not what I'm hearing now. So I can't safe consumption room, because the people that are feeding back to me are saying it's just a consumption room. It's just somewhere to use, but I wouldn't use it because I'm not going to risk getting to jail and them taking my drugs off me.
What about you, Ian?
I'm glad I came in today and got the chance to listen to Natalie, because it's a side of things that I'd never heard before. I'd never seen anything written down about actual talking to the people that it's aimed at. You know, talking to the people it's aimed at is where the data needs to come from. And I'm glad I got the chance to listen to you today. Thanks very much. You've opened my eyes and you've changed the way I see it. Because for me, it was all about harm reduction, and I was happy with harm reduction and harm reduction. No, there needs to be more to it. There needs to be far more to it. There needs to be far more put into it to make it a safe place.
But are you still happy with it as a harm reduction space? It just isn't a safe.
It's not
harm
enough.
Reduction space.
It's not enough. You know, it is part of the solution, but it's not enough. There needs to be more.
Because see, if they're for me, if they're doing wound care and all the rest, it is still enough for me for that bit of it. But I do also go in that way with that whole safe thing. I didn't even think it like that. But if they're in there doing wound care, clean needles and everything, to me that's enough. And even without the dealing with the whole psychosocial side and that, if it's just a place where people go, do you know what? I just want to take drugs. I don't want to deal with all that shite. For me, I'm happy with that.
Yeah.
Do you know what I mean? I'm not saying it's shite. I'm saying in there, if they're saying I'm not at that place in
that
my
word
journey
safe needs to be looked
safe
at.
needs to be, because that doesn't matter about what the person thing is. It just has to be the safe bit without them having and they need to know that as well.
Yeah.
So, Paul, if you get somebody waiting, right? Okay, right. I'll hang in. So, I think today's been amazing. I really have. I thought it's been brilliant. I think it's been a great conversation, and I think anybody that's interested, please comment. If you want anybody, and again, as I say, I'm happy to have I'd do this again with more people, and maybe if there's a politician, a police officer, anybody kind of interested, please get in touch and we can maybe set something up. But no, thank you very much, guys, for coming on. And honestly,
for having us.
brilliant. It's been brilliant. Thank you very much. Cheers.